Hello, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center, and I have one of my favorite people here tonight, and I'm going to tell you why. There's a couple of reasons why he's one of my favorite people. But anyway, this is Dr. Alan Bolin from Hammer Chiropractic, and he's an Edgecombe County boy, born and bred, went to Iowa, got some training, met a lovely lady, married her, brought her from the farmland to Edgecombe County.
Wilson County. We live in Wilson County.
Oh, you do?
Now, yeah, just a stretch inside of Wilson County.
Oh, okay. Did you move?
No. We're always.
It was always Wilson County. Oh,
but it's barely in Wilson County. You're close.
All right.
Now, when I say Wilson County, I'm a mile inside of Wilson County.
Oh, okay.
You're close enough.
Yeah, you're right at that Nash
County,
Edgecombe, Wilson.
But yeah.
So, what do you got to tell the folks tonight?
Oh, nothing. You know, I'm glad to be here. I always love being on your show. I usually come on a couple times a year. We talk about all kinds of good topics, good things.
That's right.
Like you said, I'm a chiropractor. I'm here to help people with all their chiropractic needs, and that can mean a lot of different things.
That's right.
You know, we have the Hammer Chiropractic show here on Tuesday nights that I do, not as often as I should, but we do it, put new episodes up a couple times a month. And anyway, most people think of the chiropractor for either car accidents or low back pain.
Right.
But, you know, we can help with a lot of things, from headaches to knee pain to shoulder pain.
Let's talk about headaches.
Okay.
Because a lot of them probably stem from problem in the neck, right?
They do. It has been proven, a lot of different research articles are out there, that most headaches are cervicogenic headaches. About 70% actually are cervicogenic, which means
that's a high percentage.
They come from some kind of issue in the cervical spine, which is your neck. What people don't realize is the brain communicates with the body through the spinal cord.
That's right.
So it's like a telephone cord coming from your brain all the way down your back and then going out in different branches all the way down. But these top 2 or 3 nerves that come out run right back up into the head. So where they come out of the spinal cord and run back up, if you've got tension, if you've got pressure, if you've got something affecting those nerves in that upper part, it's going to cause headaches. So a lot of people will come in and they will have like tension headaches, and they'll say, you know, it feels like a band around my head.
Right.
But a lot of times we can feel back here, and these suboccipital muscles, like right behind the base of your skull right here, will be just super tight and spasmed up. And a lot of times we don't even have to adjust the patient. I mean, we do, but we don't have to adjust them. We can just apply pressure on those spots, and their headache will start to just melt away because it's coming from that area. Migraine headaches, you know, that's a different one. A lot of different causes of migraine headaches, but a lot of research right now is basing it on blood flow. And the circle of Willis, these vertebral arteries come right up through your neck. And they go up into the brain, and there's a little blood vessels called the circle of Willis, which is deep in there, but they're fed by the vertebral arteries. So if those vertebrae get out of place, and I'm not talking about out of place enough where it totally cuts off the blood supply, because then we'd be talking stroke issues. But where it restricts it and reduces the blood supply to the brain on one side or the other, because this artery obviously feeds this side, this artery feeds this side, it can cause a one-sided thumping, pounding headache and can lead to migraines. There's a lot of research into that. So chiropractic care can help with it. And it doesn't help with every headache. Obviously, there's some that are chemical-based. Hormonal. I mean, you know, so chiropractic is really not going to help with that. But, you know, when you talk about 70%, that's a high number.
That's right.
And we do help quite a few people with headaches. I had a lady come in today, and she works at a computer. She sits at a desk all day, and that's exactly what we were talking about. We were talking about ergonomics, and just to go through it, because we've got a minute. If you do work at a desk, if you do work at a computer, certain things you want to make sure you're doing. You want to make sure your back is pushed up against a very nice, sturdy computer chair. In that computer chair, you want a good lumbar support, and you really want your shoulder blades to be touching the back of that computer chair if you're going to sit there with a good support in your lower back. You want your elbows at 90 degrees. So if you're sitting in a chair, you can't do it here. So this would be too high because your elbows are up. You want your elbows at 90 degrees. That's where your keyboard should be. You want your monitor level with your eyes.
Eyeballs,
So you don't want it down here because that's straining your neck. You don't want it up where you're looking up. That's putting your neck into extension. You want it level with your eyes. You don't want it to the side. I see a lot of people with their computer over here, they're like typing and they're looking this way. That puts stress on your neck. So your ergonomics is a big thing. So we talked about her ergonomics. And she said, well, my keyboard is definitely in the wrong place because her keyboard's up a little higher. She said, I kind of keep my elbows up. And when you do that, that puts stress through these traps, that puts stress through these lats, through the rhomboids. So that's going to cause pressure and tension in your lower neck and in your shoulders. But then she said also that her monitor, she kind of sat there and she said, well, I think my monitor's at eye level. And then she kind of did one of these numbers like she was typing. She's like, no, I am looking down. And she's like, well, what do I need to do? And I was like, well, it's pretty simple. I said, if nothing else, get a few books and put the books under your monitor and just get your monitor up. I mean, get it to where I'm sitting, I'm leaning back in not leaning back in the chair, but my back is pushed up against the chair, my shoulder blades are against the chair, right? You're straight up, and I'm looking straight at my monitor. And I said, that'll make a huge difference. But she was coming in with headaches, and hers weren't constant. They were off and on, usually at the end of the day. And I said, it's because you've been looking down at that monitor. And, you know, of course, we can get into all kinds of things. You're the essential nurse practitioner, so you like to talk about natural things.
I sure
but, you know, screens, anytime you're looking at a screen, there's that blue light that comes off the screens, which is hard on your eyes. It's not natural. So that's going to can affect headaches and, like I said, different things. So there's a lot of things that go along with it, but you can do things to help yourself.
Right.
So the ergonomics is one thing you can do. And of course, when we got to feeling her neck, she was very tight in these suboccipitals right there. So I did some myofascial release, which is a form of massage therapy type of deal, to her suboccipitals for a couple minutes. And she was like, at first she was like, oh, that hurts. And then after about 3 minutes, she was like, man, it feels good now. You know, it started to relax. And then we adjusted her, and she said she felt good when she left, and she's going to come back in a few days. We're going to check her out again. So.
Awesome.
But headaches is a big deal. We deal with that a lot. Everybody thinks, like say chiropractor, they think low back. And I would say probably low back is one of the number one things we deal with when it comes to people. You know, it's the second missed cause of work in the United States. You know what the first one is? The common cold, which might be COVID now since COVID is in effect.
Who knows?
But the common cold was the number one missed cause of work in the United States. Now, second was lower back pain. So, you know, we do a lot of lower back. I mean, and it's a specialty. I mean, there's a lot of people that have back pain. There's a lot of people that have herniated discs. There's a lot of people that have a lot of issues. It's funny, and if the lady's watching, I hope she won't take offense to this, but people love to Google these days. Google is
Dr. Google. I hear it every day.
Yeah, Google is a wonderful thing, but it's not a wonderful thing.
That's right.
But she came in and she was, you know, she had been Googling, and she said she thought her sciatic nerve was acting up. And I said, okay, so what's going on? And we got to talking, and she was telling me that it was affecting from her neck down into her arm. And I said, well, that's not your sciatic. I said, because your sciatic's in your leg and your lower back.
That's right.
So we corrected it, and then everything was fine. And she was a little embarrassed. And I was like, no, this is an honest mistake.
Don't be embarrassed.
She was just looking up, you know, what she had got off on was something shooting down her arm. And she probably found shooting pain, and it came up sciatica. And she just ran with it because, again, you know, she was just Googling. So Google is a wonderful thing. But, you know, she was coming in for neck pain that was radiating down her arm. And we took some x-rays. And she is in her mid-50s. She's got some degeneration in her neck, which I'm pretty sure is putting pressure on a nerve, which is causing down your arm. I'm talking a lot. If you need to interject, just stop.
Keep talking.
If you're wondering how we know these things, chiropractors look at things differently than your medical doctors, obviously.
That's right.
But there is a thing called a dermatomal map. And a dermatomal map is a map of the sensation points of your body, where the nerves that come out of your spine, where if I touch you, what nerve that corresponds with when you feel it. So if you're having numbness and tingling in your thumb and in this finger, I automatically know just from the dermatomal map that that's C6. I don't have to take an x-ray. I don't have to do anything. I know that's the C6 nerve. Now, I took an x-ray to confirm it. But when she come in and she's like, yeah, so you're shooting down my arm, and she's like, I feel these pins and needles in my thumb, kind of feels numb, and it kind of feels numb in this finger, a little bit of this finger. She's like, but mainly my thumb and my finger. I already knew, okay, C6 is the area we need to look. We took an x-ray. Again, C6 is where we saw the degeneration. I think she's got a pinched nerve. So we talked about that. And people want to know, can you help with a pinched nerve? We do, absolutely.
Sure.
Help with them all the time.
Sure.
Now, we talked about it, and with hers, it looked moderate, I'll just say. And we said, hey, we're going to try this for 6 visits. If it doesn't work, we're going to talk about getting you to a neurologist, getting you looked at. And that's the great thing about us at Hammer Chiropractic Center. Dr. Hammer's been there for almost 30 years. He has great connections with a lot of doctors here in town.
The medical community.
Right, and so, unfortunately, some of the connections we've had have started to retire because after 30 years, people start to retire.
Isn't that the truth? I don't know anybody anymore. They're all retired.
Dr. Bloom, you know Dr. Bloom?
Yep.
Dr. Bloom was my go-to for orthopedist. And I like Dr. Hasty, I like Dr. Nelson, I like Dr. Miller. There's a lot of guys I like.
Yeah.
But Dr. Bloom was my go-to strictly because if I called Dr. Bloom on Tuesday, Dr. Bloom was going to do his best to get that patient in the next week or so. He really worked hard. He was great with working with us about getting people in because, like he said, Alan, he said, I can't do his Holland accent.
I know, right?
But he said, Alan, if they're coming from you, he said, I know you've already done the exam. I know you've already done the x-rays. He said, I know you've already treated them and they need to be helped.
Right.
He said, obviously they're in pain, they need to be helped. So he was really good about getting people in, but he retired. So now I don't have that, and not that the other doctors aren't great, but they're booked up, and I called them, and they're like, "Well, it's going to be
2 weeks, 3 weeks, 6 weeks,
6 weeks."
Yeah.
And I mean, these people unfortunately are hurting, and they're like, "I can't wait 6 weeks," and I'm like, "I don't know what to tell you. That's the best I can do." I mean, they're not that, like I said it. So I miss Dr. Bloom just for the fact that he was really good about.
We
getting
need to
people
pull him out of retirement.
I'm sure he's enjoying whatever he's doing.
I bet he is.
But anyway, so we're going to try this with this lady for a few visits, and if it works, we'll continue. If it doesn't, we'll use one of our resources that we have in the area to get her looked at, because that's the great thing about working with Dr. Hammer at Hammer Chiropractic Center is we do have a lot of connections. We do have a lot of people we can talk to and get people in with, and they can take a look at them. We can refer them out. So
that's right.
It's good stuff. I mean, it's a lot of good things.
So why do we have all this tension right there on both sides of our trapezius there?
So most of it is
kind
that.
of stuff.
Yep, most of it before, well, let's just say before 2000, before the smartphone came out, most of it was totally just bad posture based. We tend to have stronger pecs. Then we have deltoids and rhomboids and back muscles, subscaps and all that stuff. So our natural tendency with tighter pecs is to roll our shoulders forward, which stretches this area, puts a strain there. I get on my kids all the time, but next time you're at any kind of meeting, a group gathering, because I'm a chiropractor, I look at stuff all the time. I go to church and I look around and I see people
sitting.
and I see everybody in
I'm
church,
bad
in the
about
pew.
that. I'm bad
Now,
about that.
what that does is
and then your phone, like you said.
What I was about to say.
Yeah.
Your head goes forward, your shoulders go forward, and you got to think, you got an 8 to 10 pound bowling ball. And I'm not saying that we got a big head, but we've got an 8 to 10 pound bowling ball. And you've got vertebrae that are about, in your neck, they're about 2 thumbs wide by about 2 thumbs tall. And there's 7 of them trying to hold up this bowling ball. Now, it's designed to balance on top of your neck. When your ear holes should be above your shoulders. So if you're sitting up correctly, your ears should be above your shoulders. So when you start to push your head forward, when you roll that head forward, that is straining all these posterior cervical muscles, these SCMs, these scalenes, all this stuff is starting to get stretched. And that pulls the rest of your body forward because you've got an 8 to 10 pound bowling ball pulling yourself forward. And Dr. Moore, you remember Dr. Moore, Dr. Greg Moore, he was a chiropractor. He had the greatest example of this. When he moved away, I should have tried to get it from him. But he had a 6 pound bowling ball on a piece of dowel rod that was about that long, a piece of round rod about like that. And he would say, I want you to hold it with the bowling ball straight over top. And you could hold it like that with the bowling ball straight over top, very little effort. But if you tilted it any direction, it got heavy. It tried hard to hold it
Right,
up.
right.
But you could hold it as long as it was balanced. It's the same thing with your head. As long as your head is balanced, it's not a lot of stress on the body, but the farther it goes forward, the more it pulls through here. Then it starts to pull your shoulders forward. Like I said, our pecs, generally speaking, in most people are stronger than our back muscles, so that also tends to pull our shoulders forward. Then when you add in the cell phones, when you add in television, when you add in anything that makes you, people that drive a lot. I get a lot of forklift drivers that come in and they're driving the forklift, they're leaning forward to make sure they're not hitting anything. Puts a lot of strain right there.
Right.
So just that constant forward pulling puts a lot of strain through there. And then, believe it or not, the old adage is stress does.
Yes.
We carry our stress in our shoulders.
Yes, that's my problem.
When you are stressed out, that is the area that generally gets the tightest. And why that is, I don't know. I don't know. I guess the good Lord knows. I'm
We'll
not
have to
100%
ask
sure.
them when we get there.
Right. I can't tell you why the cortisone and everything builds up in our shoulders and all the stress hormones build up in our shoulders when we're stressed out. But you can actually, if you take somebody and you have somebody that's fairly relaxed and you push on their shoulders, they'll feel kind of Play-Doh-y. And if you have somebody that's just burnt out and stressed out and you touch their shoulders, they'll feel like
It's
pushing
like a
on the
board.
stable.
Yeah.
And I mean, it's just the facts of life. So the old adage is correct too. If you have a high stress job, if you have a high stress position, if you're stressed about whatever in life, you're going to carry it across your shoulders. So,
Yeah.
but there are things you can do to relax that. Obviously, you want to stretch those areas. You want to stretch your shoulders. But hanging, grabbing a bar above your head, grabbing something above your head, and just letting your body weight hang and stretch those shoulders out and those traps out is a good way to kind of stretch that out. So,
What do you think about those inversion tables?
Love
Do you think those are worth their money?
absolutely. I'm a huge fan of the inversion tables. If they're used correctly, they're a great therapy. They're not going to fix necessarily your problem, but they are a very beneficial therapy. Because if you have compression, most of the time, inversion tables or traction machines that traction your neck, they have both. They're going to basically pull your vertebra apart. Well, when we stand up, gravity is pulling us down, and that compresses the spine. When we sit, gravity's still pulling us down, it's compressing. The only time we really get a decompressive state is when we lay on our back to sleep. And if you lay on your stomach to sleep, like a lot of people do, which is the worst way you can sleep, by the way, because it puts your back into an extension position. If you stretch out on your back, you can get a little bit of decompression. But when you hang upside down, that basically pulls those vertebrae apart. Now, if you've got pressure on nerves, pressure on disc, stuff like that, that pulling like that is going to decompress the spine. Now, if your vertebrae are supposed to be lined up like this, and they're misaligned, so they're lined up like this, if you pull them apart, it's going to feel better, but they're going to go back together like this. So that's why I say it's a great therapy. You still need to go to chiropractor and make sure everything's lined up.
That's right.
But in the between times, you can get some relief. You can get some pressure off of that by pulling those vertebrae apart like that.
Awesome.
So it's a great therapy. I'm a huge fan of inversion tables. The problem with inversion tables is people will buy them and they'll jump into them too quick and they'll try to hang upside down like right out the gate, which can be pretty painful because you can really overstretch things if you're not used to it. You should start out at like a 45-degree angle and work yourself up to hanging upside down. Or it becomes like everything else. Yeah, I used it and it felt great and I put it in the corner and now I hang clothes on it.
That's
and it's just like the treadmill and the exercise bike and everything else. It kind of gets started to the side. But as far as a therapy, inversion tables are fantastic. And they're fairly cheap in the grand scheme of things. Dunham's out here, you can catch them on sale at Dunham's for less than $100. I mean, for the cheapest ones. Or you can find them that are $600-700. But they're fairly cheap and they do work extremely well. I would advise though, before you buy an inversion table, you see either a chiropractor or your family doctor or an orthopedist to make sure you don't have something that's weak that doesn't need to be tractioned.
Right. That's right.
Because if you do have something that's on the verge of being, I don't want to say catastrophic, but being bad, you don't want to be putting all that stress
That's
on
right,
it. So,
that's right.
but as long as you get an X-ray and everything looks good and they give you the okay, I love inversion tables. Think they're
Awesome. All right, it's time for our first break. Now we are live. This is July 13th, and Alan's here, and he loves questions, and he loves to teach, and he loves to answer people. So give us a call, 407-1111, and we'll be right back after these advertising people. What was I trying to say? I don't know.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hello, welcome back. This is Here's Your Good Health. My name is Linda Preziosa. I'm a nurse practitioner at Family Medical Center, and my guest tonight is Dr. Alan Bolin from Hammer Chiropractic. And I said earlier that there were several things I really enjoyed and liked about Dr. Bolin. One of them is that he's a chiropractor, and I definitely believe in chiropractic work, and I've used it, and both my husband and I have been fans of chiropractors for probably longer than Alan's been alive. But anyway, you know, years ago it used to be that the medical profession especially was like, oh, they're all quacks, they're this, they're that. But we've kind of moved away from that. We're moving towards you're not such a bad guy after all.
Oh, yeah, absolutely. You know, I worked in Nashville in the beginning.
Right.
It was tough over there with, gosh, I'm blanking on his name now, I just had it. The older doctor that retired, it was in Nashville.
Liverman.
Yep, Liverman. He wasn't a chiropractic fan, and when I moved over there, I had patients that were Dr. Liverman patients, because I think he delivered all of Nashville.
Yes.
And they were like, yeah, Dr. Liverman, he's not a big fan of chiropractors. I told him I was coming to see you, and he said, do whatever I want to do, blah, blah, this, that, and the other. And I worked in Nashville for 7 years, and Dr. Liverman was still there. Now, Dr. Bello and Dr. Bondi have always been very receptive to chiropractors, which are much younger guys than Dr. Liverman was.
Another generation.
But I was really shocked. I'd been there about 5 years, and I had a new patient come in, and she was actually referred by Dr. Liverman. And I was like, what? Wait a minute. And that's what it said on my computer screen, Dr. Liverman referred. And I said, so when she came in, I was like, so what's going on? And we got to talking, headaches. She was having headaches. And Dr. Liverman told her to take some different medicines, and it wasn't really helping her with her headaches. And he told her, maybe you should try that chiropractor down the street.
Oh my God.
So he didn't know my name still after 5 years, but he knew that chiropractor was down there, so obviously. And believe it or not, I met him several times throughout the 7 years I worked there, because he was still working while I was there. And he actually sent me, probably in the grand course of things, probably 10, 12 of his patients for different and various reasons. Now, whether he actually directly told them to go see me, or if he just said, maybe you should try the chiropractor, I don't know what the actual referral process was. He never called me on the phone and said, hey, Alan, I've got this patient I want you to see. But they came from him. So everybody has softened to the chiropractic world a little bit. I think, really and truthfully, there's a lot of research that's going into chiropractic, but in the early to mid 2000s, the Germans, who are great for research over in Germany, is one thing they do really well. They did research at, can't remember the name of the hospital over there, but they did chiropractic under anesthesia. So basically, what they were doing was taking a EMG, which is an electromyogram of somebody's leg, and let's just make things simple. If you shoot, it's basically a needle in your nerve at the top of your back and a needle down somewhere else in your leg. And if they shoot 100% electricity through the top needle, they should get at least 90% out the bottom needle. And they say that's normal. I'm just making things simple. And if they shoot it down through there while you're awake and they're only getting 20%, they say, okay, there's a nerve problem. So then they would put the patient to sleep, run the EMG again. Well, while you were asleep, maybe it went from 20% getting through to now they're getting 35% through. So there's still a blockage, there's still a problem, but it's improved a little bit because now you're asleep and you don't know what's going on. They would actually have the chiropractor come in and adjust the patient's back while they're under anesthesia. So that the patient has no idea what's going on. They're knocked out. Chiropractor would adjust, they would immediately take another EMG, and they would see that, okay, now we went from 35%, now we're getting 65%. Then they would wait like another 30 minutes and do another EMG, and most of the time it was still right around that 65% range. So we've seen noticeable improvement with all the variables taken out because the patient has no idea what's going on. So it kind of proved that, hey, what these guys are doing works. They're getting the pressure off of that nerve through this chiropractic adjustment. Then, of course, they wake the patient up. Once they come out of anesthesia and get ungroggy again, they would take another EMG, and maybe it went down from 65% to 50%, but it's still a noticeable improvement. And they did this with several different people over this long study for all kinds of different things. But it was all radiating pain, but some was neck, some was lower back sciatic pain. And it kind of showed that, yes, what they are doing does work. We've taken the variable out of it, and we're showing that it does make improvement. So I think since some of these studies have come out, because it used to be, Linda goes to the chiropractor, or excuse me, Linda goes to her medical doctor. Doctor, my back hurts, my leg's numb, I'm hurting. Well, you got sciatica, we can do surgery, or you can take this medication, Lyrica, whatever, help with your nerve pain. Linda decides, I don't want to do that, I don't want to have surgery, I go to chiropractor. Linda goes to chiropractor gets her better. She goes back to her medical doctor, and medical doctor, she says, I got better. Oh, he just moved some bones around, he made some stuff pop, and you think you're better. There wasn't a hard, tangible evidence. But this manipulation under anesthesia has shown that there is evidence that what we are doing does work. It does increase that nerve flow through to the thing. So I think since then, it's giving you something you can put your hands on. And when you have something you can put your hands on, it makes you a lot more credible. And I think people have just, are going back to a more natural lifestyle.
Yes, all over.
And that's medical doctors included, like yourself.
Yes.
I mean, you preach a natural lifestyle.
Yes.
I mean, you're in the medical profession. I mean,
Yes.
you work at Rocky Mount Family Medical.
Sure do.
You know, but you're preaching a natural lifestyle, and I think a lot of your doctors are wanting to go back to that.
Mm-hmm.
And like I said, they're just coming around to the research that's out there that shows that
Right.
chiropractors do what
Right.
they do. So
It's awesome.
it is better for us now than it ever was. We should all work together.
Absolutely.
I have a buddy who is in Greensboro, and he has went back to straight chiropractic, but for about 10 years he had a integrated office, and he didn't go back to straight chiropractic because of his integrative office wasn't working. It was just more headache than what he wanted to deal
Yes.
with. But in his integrated office, he had 2 chiropractors, a massage therapist, a medical doctor, and a physical therapist all under one roof in Greensboro.
And if one
And
couldn't
everybody
fix
worked
it, everybody else, somebody, yeah. I think-
Everybody worked together.
Yeah.
So if you came in to see the chiropractor and you were in tremendous pain, a chiropractor in the state of North Carolina, we cannot prescribe medicine. Some people need medicine. I mean, some people
Yeah, of
need
course.
some people need
Yeah.
ibuprofen. Some people need pain medication because they're hurting bad. Now, do they need to stay on it? It needs to be a hammock? A safety net, not a hammock. You don't need to rely on it, but some people are really hurting. So, you know, when they would go in to see the chiropractor, they're like, Doc, I'm dying, you know, and the doctor would adjust them, and they would say, okay, he could say, okay, I want you to go see Dr. So-and-so down the hall here. Let him take a look at you. Maybe he'll prescribe you some medicine if he thinks you need it. He could see them, and so maybe he gives them some medicine, maybe he doesn't. Few visits with the chiropractor, oh, now you're feeling better. You know what, I want you to start to strengthen that lower back. I want you to see the physical therapist a few times, who's also right down the hall. And now when you get adjusted, and you go see the physical therapist. Now, great thing for him, everybody was working together, so you know, it made everybody some money, but it was great for the patient because they didn't have to travel
Right,
everywhere,
right.
and everybody was working for the same goal, which was getting the patient better.
Right.
And then you could say after they've been a few adjustments, they've been a few physical therapy things, well, now my back's just sore. Well, let's transition you over here to the massage therapist and let them work on you once every 2 weeks to work out. So you know, it all worked for the betterment. They were all working together.
Yeah.
What he ran into was the insurance side of the game was just so much of a hassle because he after 10 years he said, I can't do it anymore. I'm going back to straight chiropractor.
That's what's going to pull me out of being a nurse practitioner is the insurance.
Yep. He just got tired of dealing with it, getting denied, getting this, getting
Yes.
that, you know,
Yeah, gotta
having to
jump
jump
through
through
a
all the
hoop.
hoops.
Yep.
And he was tired of it, and he was like, you know, it's not worth it. He said it's great for the patients. He said, but the headache, because he wants to be like me. I tell people all the time, me and Dr. Hammer, we're chiropractors. We do it because we love it. We love to see our patients get better. We like to see them get better naturally without
Right.
all the drugs
Right.
and pills
Right.
and all
Right.
that. But we're chiropractors. I've got buddies that they do a lot of different things that we don't do, and that are chiropractors, but they sell supplements. They do neuropathy treatments. They do all these different things that are part of the chiropractic scope, but it's not just being a chiropractor. You know, and I love just being a chiropractor. I love finding it and fixing it and getting the pressure off of it, you know, and doing my thing. And that's what he was missing because my buddy in Greensboro, he's a chiropractor. He wants to be a chiropractor. And he said, I wasn't even adjusting patients anymore. He said, because I went to the office every day to figure out how I'm going to make payroll, filing insurance. He said it was just a headache that I just got tired of dealing with. So but a great idea because we should all work together. Everybody should work for the common goal.
And it's a great concept. It's too bad that
well, there is some in the area.
Sources.
Yeah, there is some. There's a couple in Charlotte. There was, I think, one in Raleigh that's an integrated type practice like that. If I'm not mistaken, there's one in Morehead City, but I'm not 100% sure. So hopefully, maybe it's a thing that's going to be up and coming where everybody can work together.
Yeah.
But it's.
But there's a reason that there's more and more doctors and more medical practices that will do cash only.
Oh yeah. Well, you know, I laughed at a girl, our valedictorian of our chiropractic class in 2007 when I graduated. We had 4 valedictorians because apparently the best you could make in chiropractic school was a 4.0. We had 4 people, God bless them, because I
You weren't in that group?
I was in the top 15, but that's as high as I could get. I'm not going to sugarcoat it. I did the best I could, and I was in the top 15%. I got the little cord around my neck.
There you go.
But there was 4 of them that got a 4.0, a perfect score through 4 years of chiropractic school. One of them was going back to Maine, which is where she was from, and she was going to open up a black box practice. And I didn't know what she was talking about. She said this in her valedictorian speech, that's what she was going to do. And I was like, the heck is a black box practice? Mm-hmm. Basically, her mode of operation was going to be the doors open, no appointments, you walk in, I'm going to work on you, whatever it's worth to you, you drop it in the black box on the way out.
Oh, wow. That's brave.
That's what I said, because I had a lot of, I said, maybe she didn't have the same student loans I did. I was like, but I need to get paid.
Yeah.
I mean,
And I
got to pay back, a lot of money to the state of Iowa for these student loans.
But
that's what she was going to do. And I have not spoken with her past, we are friends on Facebook. Mm-hmm. So I like some of her posts. She likes some of our posts. We wish each other a happy birthday when the birthday comes up. As far as I know, she still lives in Maine, and she's married. She's got a couple kids. I'm assuming she's still working as a chiropractor. I don't know if she's still doing the black box thing, but that's what because I asked her what that meant. I was like, what is a black box practice? And she's like, I'm going to put a box out there. If it's worth $20 to you, put the 20 in. If it's worth $5, put 5 in. If it's worth 100, put 100 in. I was like, man, that's very brave.
That's very brave. I'm not that brave. I'm like you. I got bills I got to pay.
I had too much student loans to do that. I was just looking at the number because, the day before they gave me my diploma, I had to sign on that dotted line that I will pay back these loans to the state, or they wouldn't give me my diploma until I signed it.
That's
I was like, oh gosh.
I know.
That was a large number. So.
Yes, and it's getting larger. Yes. Not yours and mine, but.
Yeah, for sure. I have no idea what it costs now, but I'm sure it's way higher.
You don't want to know, right?
So to go through, I'm glad I'm not doing it now for sure.
All right, we're going to take a break, our last break, and then when we get back, I want to talk about doctors of osteopathy and kind of how you guys are similar and how you're, as far as the manipulation goes. So we'll talk about that, because I've got 2 DOs in my office, and most people, you just know it's Dr. So-and-so. You don't realize that when she or he signs their name, it's Linda Prezioso, DO, not MD. Mm-hmm. So we'll be back in just a minute, and then we will talk about doctor of osteopathy versus a chiropractor. They're not really the same, but I just wanted to kind of go into that a little bit. So don't go away, and if you got a question, give us a call, 407-1111. See you in a minute.
Come celebrate our 20th anniversary with us and see how we can help with your hearing challenges and hearing care. To celebrate this monumental occasion, when you buy a pair of Livio 1600 series hearing aids or higher, you get 1 hearing aid for free because it helps to have a spare of equal or lesser value. We know how inconvenient it is to have your hearing aids serviced, maintained, and repaired without a spare. As a community provider, we are focused on individualized care as personalized as your fingerprint. We build relationships with our patients and believe that is the only way to provide the quality of service that has kept us in business for more than 20 years. We have grown and stood the test of time while embracing technological advances and innovations in our industry. We couldn't do it without all of you.
You don't know what anybody can do for you until you have a problem. And when you have a problem, is how the person works through that problem that makes them effective, makes them beneficial in your life. I get involved in a lot of activities at our church. And with the music and things that are going on, I'm going to my noisy setting quite a few times, and then depending upon who's speaking, I may be going to what they call a theater setting, which is a higher level, and so you have to negotiate. You only have, in my case, I only have like 3 different levels now. She does have some technology. We have some different volume controls. I don't use that, and I have to work with her, and rather than having to come back to the office, it's easier for me to call her wherever she's at, and we'll set us up a time, and then she will readjust my hearing aids over the telephone. which works real good. And I've used that quite frequently. But usually once you get set up, you don't typically have to change much. And a lot of times people don't want to go through the pain of the setup process, but if you don't spend the time in the setup process, you're not going to have the long-term results.
We are thankful to our faithful customers and look forward to many more years of service to our community.
I would say patients, they say it for us. You know, they refer people to us all the time, and they're not going to refer if they're not happy with you. If they don't think you're going to take care of their friend or their family member, they're going to shut up. You're going to shut right up. They're not going to say anything. And I've built my business on 75% referrals.
We offer convenient financing, layaway, and many pay options to ensure that our customers have comfortable experience getting quality equipment, reliable service you can depend on, and the product that fits both your physical and financial needs. Please visit our website, downeasthearingcare.com. Don't miss out. Schedule your appointment today. This month, we would like to invite you to our VIP 20th Anniversary Open House Hearing Healthcare event. During this event, we are offering one free Livio RIC hearing aid with the purchase of 2 Livio MRIC devices per person. Receive an expert, no-obligation hearing consultation and free product demonstration. This limited-time offer is available at our local hearing clinics. Get answers to all hearing-related questions. You can reach our convenient locations in Knightdale at 919-500-7455 or Rocky Mount at 252-378-2018.
Hello, welcome back. This is Here's to Your Good Health. I'm here with Dr. Alan Bolin, and we're going to talk about a doctor of osteopath versus a chiropractor. Now, there's certainly big differences because Alan can't write a prescription. Alan can't treat you for diabetes or for hyperlipidemia, but doctors of osteopath, they do some manipulation. Is it similar to what you all do?
It is very similar. The difference would be, so your doctor of osteopathy is just as good as...
Was I saying it wrong?
No, you're maybe I'm saying it wrong, but they're just as, an osteopath, let's call them that.
There you go.
Is just as good as any medical doctor. They go to the same trainings.
Right,
they have
right.
full surgical rights. They're full rights in most hospitals. They are a doctor, a medical doctor, just like your general practitioners are for the most part. So they're fantastic for that. They do learn some manual manipulation treatments, which is great. That difference would be in chiropractors, like you said, you hit the nail on the head. We can't prescribe medications. We do things naturally. The osteopath, they learn manipulation, but they don't concentrate in it like a chiropractor does. We focus on it, and ours is a lot more in depth and a lot more. There's a lot more manipulations that we learn than they learn, but it's very similar. It's and they do good work. I like osteopaths. I think it's a good bridge between the two.
Right,
you know what I'm saying?
right.
And it was something that I kind of looked into when I was going into chiropractic school. When I thought about when I said I was going to be a chiropractor, somebody asked me, "Why have you ever thought about being an osteopath?" And I was like, "Yeah, no, not really." And then I kind of looked into it. I was like, "Well, it kind of hits right in the middle there." But I really wanted to do things naturally. I wanted to be. I still think that that there is need for medication. There is need.
Absolutely.
If you have cancer, you need to go to an oncologist.
Absolutely.
You need to get radiation. You need to get chemo. If you have, like my son is type 1 diabetic, he needs his insulin.
Absolutely.
There ain't enough adjustments in the world that's going to bring his blood sugar down. Now, if you have arthritis, do you need to be on the Celebrex, or do you need to kind of be exercising and getting your back adjusted?
Exercising and getting your back adjusted
Will help a lot.
Yeah.
And may be better for your, or excuse me, not maybe, is a whole lot better for your liver and your kidneys than the Celebrex is.
Yes.
Now, Maybe you need to be on the Celebrex in the beginning so we can get you back to exercising and getting your back adjusted.
Sure.
But then we get you off of it.
Right.
Again, it's one of
Right.
those, it's a crutch, it's not a wheelchair.
That's right.
You know? So again, I like to do things naturally, but osteopaths are great. They do some, and some do more than others. You have some osteopaths that really do a lot of manipulation and some that do very little, but they do learn a lot of similar adjustments that we do. We get more specific and we specify in it.
Right.
And that's the thing that I want to tell people. When you go to the chiropractor, let me back up. Let me tell you a little story. So there was a plumber, a young plumber. He was working on a toilet and he couldn't get it to stop running. And he couldn't get it to stop running, and he called all his plumbing friends, and they come and looked at it, and they didn't know how to get it to stop running. So finally, he called the old retired plumber that was in his 80s, and the retired plumber come down there, and he took a ball peen hammer, and he tapped the bottom of the tank, and it quit running. And the young plumber's like, man, he's like, how much do I owe you? And he said, $100. He said, $100? He said, all you did was come down here and tap it with a hammer. He said, well, you owe me $1 for the hammer tap. He said, you owe me 99 for knowing where to tap it.
There you go.
And that's what a chiropractor does. We know where to tap the hammer.
Right.
An osteopath would too, but my point is, when you see somebody and they're like, oh man, I don't need a chiropractor, and they twist their neck and they twist their neck and you hear things popping, they have zero idea what they're popping. They're just moving their neck and things are going crunch, crunch. Is that going to hurt them today?
No,
maybe not.
maybe
Is
not.
that going to hurt them tomorrow? Maybe not. But eventually, they're going to twist something wrong, and they're going to injure a ligament, or they're going to strain a muscle, or they're going to rupture a disc, and they're going to have major issues.
That's right.
When you go to chiropractor, we're not popping anything that'll move. We are feeling for the one that is stuck,
Right.
and then we are pushing that one in a specific line of drive, a specific way of pushing it, so it goes where we want it to go.
Right.
And that's what we learn as chiropractors. And I tell people all the time, I said, you know, one of the older chiropractors that was in there said, you know, we could train a monkey to pop a bone. He's like, we got to train you to know which bone needs to be popped.
Right.
Anybody can go in there and push and make something pop.
Right.
But you got to know which one needs to be popped, why it needs to be popped, where it needs to be popped, and which direction it needs to go. So I tell people, and I had a girl 6 months, well not even 6 months, 3 months ago. She was in a car accident. She came in with her boyfriend, 3 or 4 visits, young girl, she was in her early 20s. And it was a Friday, and I adjusted her lower back because her lower back was hurting from the car accident. She came in on Monday. She's like, man, I'm glad to see you. My back has been hurting all weekend. I said, well, okay, let's lay you down. We get to talking. And I adjust her lower back again. She's like, oh man, she's like, it felt so good. She's like, my boyfriend tried to do that on Saturday. And she's like, it hurt worse when he got done. I was like,
yeah.
no joke, Dick Tracy. I mean, you know, he's not a chiropractor. What made you think that he was going to make it feel better? He's like, he watched you do it. He figured he could do it. You know, so
There's a reason you went to school for all those years.
exactly. That's what I
Yes.
tell people all the time. You know, that it's not just about making something go pop. You know, you got to know what you're doing. You got to know where you're pushing.
Right.
You got to know what
Right.
you're doing. So, back to the osteopaths, though. You know, they're great. Dr. Perlmutter is an osteopath.
Oh, is he?
And I'm pretty sure. And he does a lot of hand work, and you
Yeah.
know, we refer to people for the hand. He's a hand specialist, and I like him a lot. And so we got a lot of good osteopaths in here, and they do some manipulation as part of their training.
Right.
They just don't specify in it the way a chiropractor
Right.
does. I guess basically where they branch off into the pharmacology side, we stick with the
Right.
adjustment side.
Right. Gotcha.
So they learn a little bit, but and they're great. Like I said, like some does more manipulation than other. And you know, for arthritis and things, an osteopath's a good person to see because they'll be able to, like I said, do some adjustments, and if you need the medication, get you there.
Right.
So
do you work on impingements of shoulders?
I do. Impingement syndrome is a booger, and
I think that's who I sent to you, somebody that had an impingement syndrome.
we can do some good things with impingement. It's tough, and it depends on what is causing the impingements and things. And if it is truly an impingement syndrome, because the impingement syndrome is when the nerve gets trapped under that clavicle coming through right there, and when you flex and do things, pressure and causes pain. But we do a lot of shoulder adjustments for impingement syndrome. A lot of times what happens is the muscles get tight and it draws the shoulder up. So we want to relax those muscles. We'll do that myofascial release. We'll do our muscle stem. We'll do our ultrasound to try to relax those muscles to get that muscle to relax. And then we do a traction style adjustment on the glenohumeral joint. Sometimes the AC joint is not really one that gets adjusted because it doesn't move very much.
Right.
But we can do some traction on the AC joint to kind of open it up, stretch it out a little bit, and help impingement syndrome out. The problem with most impingement syndromes is though they're caused by repetitive motion. And most time the repetitive motion is what people do at work.
Yes.
And people have got to go to work.
Yes.
So, this old adage, well, it hurts when I do this. Well, don't do that anymore.
Right.
Well, I've got to do this because
Right.
I'm a carpenter and I use a nail or a hammer all the time. But I can't stop doing this because I got to go to work. So, impingement syndrome is a tough one. There's a lot of tough ones like that, like intercostal muscle sprains. People that are picking something up and they strain like the muscles in between their ribs, and they're like, oh man, it hurts so bad. Every time I take a deep breath, it hurts. Every time I move, it hurts. Why does it take so long to heal? Well, every time you breathe, that muscle's expanding and contracting, expanding and contracting.
Right.
If you could not breathe for 2 weeks, it would heal up. But you got to keep breathing.
Problems,
there would be a lot of other problems then. So you got to keep breathing, and when you're breathing, you're expanding, contracting, expanding, contracting. You're working that muscle, it doesn't heal up. So it takes a long time to heal intercostal sprain. Stuff like that.
What about tennis elbow?
Tennis elbow we can do a lot of good for. Tennis elbow is inflammation. It's of the olecranon process. So golfers' elbows on the outside, tennis elbows on the inside. And I don't know why, I guess golfers swing differently. But inflammation of that area. Elbows, we can adjust elbows. They're not, again, they're kind of like the AC joint. They don't really get out of place because they're a hinge joint. They hold in there really well. But that inflammation builds up in there. Our muscle stem is great for getting rid of inflammation, but our ultrasound machine, our therapeutic ultrasound machine, is fantastic for getting inflammation out of that area, out of the joints. So we do ultrasound on it, we'll do muscle stem on it. Acupuncture is also very good for it. Dr. Patel does a lot of acupuncture. I haven't done much acupuncture lately because I stay so busy with the chiropractic end of it. Acupuncture takes probably 40 minutes for the patient, but it takes a good 20 minutes of my day putting the needles in, taking the needles out, doing all that stuff. And I have to budget my time to get an acupuncture patient in because we stay so busy with the chiropractic end. But Dr. Patel pretty much specializes in acupuncture at our office. She does some adjusting, but she's pretty much all acupuncture. So they schedule her patients where she's, got rooms available to do acupuncture, and she kind of just floats room to room to room doing her acupuncture. But acupuncture is great for tennis elbow. Any kind of itis, acupuncture is generally good for. Shoulder, like bursitis. The ultrasound machine is really good for bursitis in the shoulder, but we do a lot of acupuncture for bursitis in the shoulder. People don't know about it, but acupuncture for allergies in the spring, really beneficial for a lot of people. Yep, it's a lot of needles go in your sinuses and through your ears and your face, and it doesn't hurt. The needles are tiny. It trips me out when I have these people that come in, and I'm not nothing against people with tattoos. Do whatever you want, but I have people that come in that have 7 or 8 tattoos, and they're like, I'm scared of needles. And I'm like, wait a minute. I don't want to do the acupuncture. I'm scared of needles. I'm like, yeah, but you got like 5 tattoos on your arm over here. What do you think? They didn't paint those on. I mean, there was needles going in your skin to do that. I was like, and she's like, yeah, but them needles, this one girl told me, them needles that you do acupuncture, they're long needles. No. And I'm like, well, they're about that long, but I said, don't stick it all the way in. I was like, it just barely goes into skin.
I know.
So it's just
when you got to get down into the nerve.
Yeah, I mean, it doesn't go in very deep, but it is a long needle, but I'm not like jabbing it all the way in you. So it's fun, but acupuncture is really beneficial for a lot of people. We do that at our office. I can do it. I'm certified in acupuncture. It's just that I just don't have a lot of time. Now, if somebody comes in and says, Dr. Bolin, I want you to do my acupuncture, I will budget time for that person. I do a lot of guys, strictly because when you have to get into like low back pain and sciatic pain, they might feel a little uncomfortable having a woman, look
Yeah,
at
yeah.
their bare rear end, and when you got to get down to that nerve that's going through your cheek there, you got to get in there. So I do some of the acupuncture for that, but most people are pretty cool about it, and they see Dr. Patel, and she does a great job with her acupuncture. She's really good at it.
Is she there? And she's not there every day, though?
She's there Tuesdays and Thursdays.
Okay.
And she's in Tarboro. If you don't mind driving to Tarboro, she's there on Monday, Wednesday, and Friday. But she's in our office in Rocky Mount on Tuesdays and Thursdays, and she does a fantastic job with acupuncture. She's really, really good at it.
I've heard good things about her. I've not met her, but my patients, I know everybody in town from patients, how they treat how they treat their patients and that kind of thing.
Dr. Pill's as good as they come, and she's very good. She's very good. I know she works with me. I'm not just trying to pump her up because she comes to our office. I mean, she's very good with the acupuncture. I don't know of anybody in town that has the success that she's had, and I don't want to speak out of turn, but I think she's even got a couple of acupuncture babies out there that people were having trouble getting pregnant, and they come in and had acupuncture done, and they've been able to get pregnant after the acupuncture treatment. I think she's. I don't want to speak out of turn, but I know I'm almost.
I know you can
sure
do. I know that you can do acupuncture to help. I don't know how it works.
Right.
Well,
it would take more than the 3 minutes we have to explain it, but it's all about, there's meridians and there's a conception vessel, and you put the needles in the conception vessel, meridians, and all sorts of stuff. So, but it does work, and like I said, I don't want to speak and tell a total lie, but I'm pretty sure she's got a couple. And when you can do something like that, that's pretty amazing. I mean, people that have had a hard time getting pregnant, and then, for lack of a better term, they come in and see you a few times, and all of a sudden, bam, pretty amazing stuff. So she's really good at what she does.
Well, Alan, it's always so good to have you. You just don't come enough, but he's a daddy, and Wednesday nights is church night, and his kids play sports, and he's just got a lot of other things other than coming to this show, and I certainly appreciate that. He's a great dad.
And you got to raise the cows, right? You got to keep the food.
That's the other thing I love about Dr. Allen. We certainly share all of the natural things, and one of them is good, healthy eating. And he raises steer, and I buy a quarter of a steer from him every year. And I guess it's been about 3 or 4 years now.
Yep, going on that. Just to let everybody know, I'm a small operation, but we do hormone-free, steroid-free, antibiotic-free. They're not organic. They're about as close as you can get, but we do feed them grain that's not organic grain. But they're about as close, about as healthy as you can get them coming off the hoof there. So really good, clean
grazing
meat.
in that pasture. Yep. And now I'm begging him for pigs, so I can get me some pork too.
Working on it slowly.
Yeah. I'll talk to his wife. It's always the wife that makes him go.
That is true.
All right. Well, thanks so much, Alan. So good to see you.
Yes, ma'am.
Thank you so much for watching, and we will see you next week with more of Here's to Your Good Health. Good night.